study got two parts. The other part is the abrasivity test. So they use the bovine teeth. Okay, so that they remove the tooth from the jaw apparently, and then afterwards they cut into small cube, and then they mount into resin, and then even use this weakest hardness number because they want to, because sometimes we know that some people their teeth is more brittle, some people their teeth is harder, right? So they want to make sure that they fall in the same range. Okay, so the hardness is 280 to 380. Okay, so after that, they say that okay, they start from the similar hardness. Afterwards, right? Then they say okay, so this study they want to negotiate, want to test people brush their teeth with rolling technique. So when you brush your teeth, how many times do you brush? Like 5 times, 2 times? Yeah, so like 10 times. Okay, so 10 times. They say people brush 30 strokes per day. So they then see how to, okay, so imagine if they test for 1,800 is 2 months, and then 6 months, 12 months, and 24 months. After brushing it, they test to see how abrasion has caused with this. Then they use the scanning electron microscopy to have a look. Okay, then we see the result. So the cleaning ability, actually they find that for the cleaning ability, between these two groups of patients, they can't find any difference. With the extra soft and the soft one, they actually brush pretty, even though it looks like the ultra soft is a bit cleaner, but it's not significant. But this also tells us that actually the extra soft one, because we always got the question that the patient always asks us that, is it the better if you buy the harder toothbrush? Because they always worry that the soft toothbrush cannot brush properly, cannot brush clean enough. But actually, yeah, that's not significant difference according to this study. And for the abrasivity, so basically they have a look. The one with the groove, and so this is the left side is the one before they brush the teeth. The right side is the one that after they have observed. They observed that the one, especially for the children and the gum patient, the gum group, they actually have a less abrasion among the group with the ultra soft toothbrush. Okay, so the discussion is actually in the experiment on the cleaning ability. The ultra soft and the soft toothbrush, they did not show a statistically significant difference. So meaning that they actually brush more or less have a good result. And for the patient, right, in the 24 months brushing, they actually find that the brushing in the soft toothbrush compared to the ultra soft, it has a higher abrasivity than the, yeah. So that's why we always want to do a softer toothbrush. So the conclusion is, so they suggest that actually ultra soft enlarge the plaque removing ability of the soft toothbrush, and also in the same time protect the patient from having too much abrasion against their tooth, and so that we can reduce like sensitivity, abrasion, root canal treatment, extraction. Okay. This is my reference. Okay. Thank you for your attention. I would like to say thank you to UKM again for inviting me. Yeah, this is also the photo I searched. Yeah, I've never been here before. Thank you so much. Do you have any question? Okay. Actually, Prof already requested the Lincoln company to prepare sample for everyone. Yeah, but the one who have, so Dr. James, the one who have answered the question, can they get one more?
Haven't answered the question.
For the one who has?
No need lah.
Okay, so yeah, Dr. Okay, yes.
Doctor, regarding the picture just I was next door, then regarding the designs and the crystal, right? Okay, what's the specialty about it?
This one, okay. Yeah, actually this one, the question regarding the product, maybe Dr. James? Dr. James?
Yeah, in relation to the strokes that you have shared with us just now, how does how does the design of your toothbrush relate to the different strokes?
So for this one, right, actually when they design the shop, they just try to test that if they use it for 2 months, then 6 months. For this test, they actually didn't test the wear off of the toothbrush. So they just design it because they want to test that if the patient brush their teeth for 2 months, then how abrasion it can get. It's just so it's
Nothing to do with
yeah, nothing to do with the design.
But I'm guessing that the brush are all straight, right?
Yeah, it's all straight. It's not cross. So it's all straight and then same level as well. Yeah. So but they try to make the different configuration. Actually, all the Bristol they are same, but they use a different configuration to make the toothbrush more flexibility. So to make it a bit softer. So actually, yeah. So Dr. James, do you want to answer to the question just now? The design. They want to ask about the design of the toothbrush and then what is the difference? How does it relate?
Okay, actually the design here, mainly there are different design. Beauty is the S pattern, and also the gum series is the tube shape design, and also next comes the clinic design. So you have.
You can explain first. I can transfer it in the meantime.
So basically, this design, in Linko company, they have a scientific R&D team behind of this design. Basically, they just want to increase the cleansing efficiency of each and every single strokes. Okay, so for beauty series, the S pattern actually is just to increase the surface cleansing, the surface covering of the teeth. For the clinic series, it has a small polishing cup design, basically just to reduce the irritation to your teeth and to your gums. And for gum design, basically you can use the gum toothbrush to brush your gum actually. You can go ahead and ask the patient to brush your gum, and to the teeth also, half partial with gum, partial with teeth. The design in details, I have not gone deep yet, but I think it's a very, it's just basically to increase the brushing efficiency. Basically it's that. Thank you. I'll just show you here. I just show you here. Yeah. So you can see here. So the S pattern actually is the white bundle and tightly cleansing and shiny, just to increase the surface area of your teeth. This gum design, cleansing and massaging the tooth, and gum at the same brushing. Okay, tooth shape design. So this is a 360-degree shape, low irritation design. So, okay, comb shape, low irritation design. So basically, just that, right? So I hope I answer Dr. Chong's questions.
I think he's out. The doctor who asked the question is outside.
Thank you.
Yeah, do you need any question? Okay.
Hello, I would like to ask a question. Actually, there are two questions I would like to ask. So, in general, for us dentists, explaining to the patient, of course, we can explain the techniques, explain the preferable toothbrushes, but what do you think is the most important that we have to explain? Because if we explain the techniques, maybe patient will have some difficulty learning the techniques, rather than we should focus on what type of toothbrushes. So what do you think is the most important things we have to mention for the patients? And the second, I would like to ask, do we need to, I saw that this toothbrush is very special. I see it's very, the size is 0.01, isn't it?
Ah.
So I think it's pretty.
The tip.
Yeah, the tip is 0.01. It's very tightly made for each of the bristles. So is it possible that fruit debris will more easily, get into the bristles? And do we have to disinfect it first or something? Is there any disadvantage or some things that might make it more difficult for the
Yeah. Okay, thank you. Thank you, Dr. What's how to address you?
Van.
Oh, Ben.
Yeah.
Okay, Dr. Ben, thank you for your question. So the first one is about the oral hygiene. Actually, by the time that I did my training at UCL, actually our teacher always said you need to demonstrate the brushing inside your patient mouth. So I actually never, after that, I never show the way the brushing on model because I feel that it just doesn't work. I want to see how the patient, their dexterity, and how do they clean. Actually, apart from the brushing, because I find that most of my patients, they brush their teeth, buccal and lingual very well. But the interdental, but it's something that I haven't addressed today. I always do the interdental cleaning. This is something that I reinforce the most for the patient with periodontitis. And we also have the luxury that back in UCL at Eastman, that the TP, I'm actually not sure that is was it the hospital who bought it or just the TP gave a sample. So actually at every kit, we have different size. So actually myself already get an idea when I see the patient mouth, I can suggest them which size they should go with. So I think if you also can get yourself familiar with that, you actually can give your patient a very precise advice on the interdental brush they should use. And it can also help, and also ask them they have to bring their toothbrush next time. And I always do pet control for my patient, even until now, because even though it's time consuming, but it's just so much. It's just so important because when the longer you work, you realize that if your patient brush their teeth well, everything you work for them, it just work. And so the second question is about the fruit debris. Actually, for this one, right, if you can see that we actually got quite a lot of questions from the doctor. They ask, why do you have this kind of like groove in between? Actually, we also understand that if we have the bristle too packed, too close, too densely inserted, it have the problem of food debris. So that's why we designed this groove for the food, just to, after you brush the tack, and then you can see the food come out. Actually, I have been using this toothbrush for a long time. And yeah, sometimes I do see debris in the groove, then I wash it, it just goes off. Yeah, thank you. Yeah, I hope it answered your question. Yeah. So thank you so much for your time. Yeah.
Thank you so much, Dr. Ko, for a very interesting talk regarding the toothbrushing techniques. So now let's proceed with the next talk by, I would like to invite Miss Tung. She's here already. Miss Tung to deliver her talk.
You said